All right. Hi, everyone. My name is Dr. Liz, and I'm a dentist, and I'm also really passionate about oral systemic health. So, with all of the COVID-19 information and sort of crisis going on right now, I'm getting a lot of questions from my patients because my practice is actually closed right now. I'm a general dentist, and we do see patients for emergencies. However, it's been really hard to just stay open only for that. So there's very specific times that we're open for emergencies only. And this is based on the guidance from the American Dental Association that came out a little over a week ago now, urging dentists to cease all non-urgent dental care that's happening in their offices at any given time. And I think that this is a good thing because the virus is known to spread in aerosols, and we produce a lot of aerosols in our office with regular dental treatment and things like that. So just kind of mitigating the spread of the virus is really what the closure of some of these dental offices is all about. It's very similar to the advice of social distancing. So we don't want to be sending our kids to daycare right now. We don't want our kids in schools. We don't want to be holding conferences right now. That's kind of the same concept, except that, a dental office generally doesn't have the concentration of people, but we do produce the aerosols and things. And so infection control is a concern. While we are all practicing universal precautions, I think mitigating the risk as much as we can is the professionally responsible thing to do. And so right now, most offices, especially in states that have proclaimed an order for dentists to cease non-urgent dental care, the whole point is to really just be responsible in terms of the services that we're providing for patients, and responsible in terms of our use of things that hospitals need, like gloves and masks. So right now there's a lot of, actually in the dental community, there's a lot of donation programs where dental offices are donating their excess masks and the masks that we're not going to be using for the next several weeks, obviously, to hospital systems, which is really great. So there's kind of a twofold reason for ceasing the non-urgent dental care. And it's, the mask issue and the potential for this virus to continue spreading at the rate that it's currently spreading. So now the question is, you can't see your dentist for your regular things like cleanings and maybe some standard fillings, but what if you have an urgent need? What's considered a true dental emergency versus what can wait? And how can you keep your teeth healthy in the meantime? Because what if you were due for your cleaning tomorrow and you can't go in, and now you have to wait? In my state, it's 2 more months before we can start seeing patients, and that's a minimum 2 months. So what can you do in the meantime to prevent infection, to prevent gingivitis from flaring up, that kind of thing? So let's go into what a true dental emergency is. So a true dental emergency is bleeding that won't stop. So if you had an injury, or let's say you had a recent extraction of a tooth or something like that, that's healing. Let's say that started bleeding and it won't stop. That's considered an emergency. Another thing is persistent or worsening pain. So this would be throbbing, and maybe it started out as hot and cold sensitivity, but now it's throbbing, or now it's keeping you up at night. And maybe this happened over the course of a few days. So it kind of came on suddenly, right? So that's something that's not likely to get better. Another source of sensitivity could be, let's say you broke a crown And so now part of that crown is off your tooth, and so part of the tooth is exposed and it's really sensitive. Or let's say you broke a filling, something like that. So where part of the tooth is exposed now that wasn't exposed before, and it's super sensitive. Another emergency could be an infection. So, you know, not everybody knows what tooth pain is like, but it's not very easily tolerable. So an infection can be something that is causing that pain to get worse over time. Now, the reason that this is an emergency, even if you have like swelling in your face, but you don't have a toothache with it necessarily, that's not a good thing either. So sometimes, like, if you've already had a root canal on a tooth, you might not feel that tooth, but if you get swelling in your jaw down here, that's not good. So that's a sign, that's a potential sign of infection. So we want to make sure that we're treating these kinds of things, because what we don't want is someone to have to seek a hospital emergency room for that infection or for that pain. Right now, if you don't already have symptoms of cold and flu, please, please, please don't go to the hospital emergency room. And even if you do feel really sick, you know, the nurse hotline is a great place to start. For those things to kind of help you determine, do you need to truly go to the emergency room? Especially if you're not having cold and flu symptoms right now, but you have tooth pain, the last place you want to be is the emergency room, where almost everybody there is probably going to have some cold or flu symptoms, and you don't want to expose yourself to that. So if you are having a dental emergency, really try to avoid the hospital emergency room. Now, cases that you might need a hospital emergency room, if you have a fever associated with infection and you don't know where that fever might be coming from, like let's say you don't know that you have an infection, you don't have tooth pain, but you have a fever, that might be something to call your doctor about, or the nurse's hotline, and kind of assess from there. But if you do have tooth pain and you can pretty well isolate it to your mouth or your face, call your dentist. If you don't have a dentist that you see regularly, a lot of clinics have emergency phone numbers, and a lot of clinics are also still open to accepting new patient emergencies. So if a dental clinic is open, it is likely only seeing emergencies, which means that you might get an x-ray and a clinical exam. You may or may not necessarily get actual treatment at that time or at that clinic. So I'll get into that in just a second. What I'm doing for my patients is, since my physical office is really not open at this time, we have a very limited office hours that'll be coming up later in April. For emergencies only and urgent needs. What I'm doing is accepting phone calls from my patients of record. So this is where, you know, if your dentist is only, if you don't have a dentist and you call a dentist who's only taking emergencies for patients of record, you know, keep calling, it's okay. But they might do a phone screening for you and then refer you to the appropriate specialist. So specialists who do root canals and specialists who do oral surgery, those offices are tending to be open right now because we're really trying to avoid dental patients with dental pain going to the emergency room for that pain. We want to keep them out of that environment, mitigate the risk of them contracting virus that's going to be spreading all over that emergency room. And we really want to kind of help reduce the burden that's on our hospital system right now. So endodontists, the root canal specialists, and oral surgery is going to be kind of the way to go right now. Should you have you know, a bad infection or a tooth that's broken and can't be fixed, something like that. So what I would do for my patients if I had an emergency phone call, is to kind of see what kind of pain they're in, and is this a patient of record? First of all, do I have a previous x-ray on this patient? And is it recent? So if I do, I might say, okay, I'll call in some medication for you. And that might be some antibiotics. It also might be like an extended release ibuprofen or something like that to mitigate some pain. That can also be managed at a specialist's office. So if it's determined that, yes, you need to see a specialist and have this assessed in an office somewhere, the endodontist or the oral surgeon may also be the one to prescribe medication for infection or pain management. So depending on whether that office is actually going to be treating the situation or not, that's going to be kind of up to the provider and you as the patient. So if you feel comfortable having actual treatment done that day, that's awesome. Get yourself out of pain, please. Dental pain is nothing to mess around with, and it doesn't go away just because you took antibiotics. Antibiotics can help reduce the load of infection that your body is experiencing, but it doesn't cure the infection because the source of the infection is still there, which is usually the tooth, right? So we need to do something about the source of infection, and that would be definitive treatment, either root canal or removing the tooth. Now, that's going to be actual treatment that day is going to be something that you're going to have to kind of discuss with that provider and make sure that that's something that they're offering at this time. The specialists that I refer to are treating patients. They have upped their personal protective equipment game quite a bit. We always practice universal precautions, but they're doing a lot of extra things now that we don't know entirely what the new recommendations are going to be in terms of infection control after this whole sort of imminent crisis is handled. There's going to be some changes coming along. But right now, the specialist offices are really just kind of going all out with the masks and the goggles sealed to their faces and everything. So they are able to provide some treatment should you need it. So let's see here. Oh, things that might not require a referral to a specialist, but could. So like, let's say you had a filling pop out, over the phone. I don't know if that is how deep that filling is. I don't know if that filling had a cavity underneath it, and maybe that's why the filling came out. I don't know if maybe you're just eating a caramel apple and the caramel just pulled it right out. I don't know the conditions of that tooth without clinically looking, but if that's sensitive, that's pretty normal. It'll be pretty normal to have some cold sensitivity if a filling pops out or if a piece of tooth breaks off or something like that. Because now you have an area of the tooth that was exposed where it wasn't before. So you'll probably have some cold sensitivity, maybe some hot sensitivity. It kind of depends on the condition of the nerve of that tooth. But if you have some cold sensitivity and it's really bothering you, there are some things that can be done without producing aerosols, either by your general dentist, if they are open to see emergencies right now, or by like the endodontist, the root canal specialist, because they do have these materials as well, typically the temporary filling materials. So there's just a temporary filling material and some desensitizer that can be applied to the tooth in the case that something is broken or missing, and they're not doing regular fillings at this time at your general dentist office. So there's some temporary things that can be done. So that's great. Another thing is too, like if you feel like it's a relatively small little filling that popped out, there is temporary filling material available at the drugstore. So while I don't love it, it can get you over for a few weeks if you need it. The other thing that's available at drugstores also is temporary crown cement. So let's say you have a cap or a crown that falls off. Now, there's a lot of reasons that a crown can fall off. So I can't diagnose anything necessarily. However, if a crown falls off and there's still tooth structure in your mouth to hold it in, there's temporary crown cement available at drugstores that you can kind of put it back in. What you want to do is kind of practice so that you put it in the right way, because if you put it in the wrong way, you can bite down on it and cause problems in the rest of your mouth. So you definitely want to make sure that you try it in first and make sure that it's in the right way. The other thing is that the drugstore temporary cement is not a long-term solution. It still needs to be addressed. It still needs to either be re-cemented permanently, or sometimes the crown has to be redone, which, if there's a cavity underneath the crown, sometimes that's why it comes off. So, replace it with some temporary cement for the time being and see a dentist as soon as you can. Now, if there's pain associated with this, especially throbbing pain or heat sensitivity that doesn't go away, that would be an emergency situation. Definitely call your dentist and see about a referral for a possible root canal. Okay, I don't want you to be sitting in pain, especially because as that pain gets worse, you might be tempted to go to the emergency room, and we don't want that either. So let's see, there's definitely going to be some follow-up after all of this. So regardless of whether you ended up getting any emergency treatment or whether you're kind of holding off with a temporary situation until dental offices are open for regular treatment again, you definitely want to follow up. And if you weren't seeing a dentist regularly before and you had a dental emergency during this time, you definitely want to establish care with a dentist, whether it's the same one you saw for the emergency or whether it's a different clinic. It doesn't really matter. I would strongly encourage everyone to just make sure that they follow up after we're back to normal in the office and everything, after kind of the bigger part of the social distancing is sort of relieved and lifted. Now, what can you do in the meantime? Like, let's say you're not having an emergency. Great, that's awesome. Let's say you just missed your cleaning. What's the best thing to do? Well, we always recommend, of course, brushing twice a day for 2 minutes at least. Sometimes it's really hard to reach all those teeth. I get it. If you're going 8 months without a cleaning when you normally go 6 months or 4 months or something like that, there's going to be some extra stuff on your teeth, right? So our dental hygienists and dentists are going to definitely expect to see a little bit of extra stuff in there when we finally are able to get in there again. But to make sure that you're staying healthy at home, what are the best things to do to keep your gums healthy, avoid cavities, that kind of thing. We definitely tout the, brushing twice a day, flossing once a day, which is very, very important. The mechanical removal of the bacteria on your teeth. That's hugely important. But another big portion of that is actually what are you putting in your mouth to eat and drink. So we've done a lot of stocking up on some prepper items, right? Boxed foods, non-perishables, canned foods, that kind of thing. What I will say about that is that, when things are very carbohydrate heavy, they're really going to stick to your teeth. So keep in mind, what are you eating during this time? Are you able to eat some of those fresher foods, or at least, vegetables and some meat and stuff like that? That's going to be really key in kind of helping to keep your teeth clean, actually. So some of those carbohydrate heavy options, the pastas, the boxed mashed potatoes, the rice, all that kind of stuff is really going to stick to your teeth pretty badly. So keep that in mind. Another thing is too, I was seeing a lot of the aisles in the grocery store that have like juice and stuff like that. Like the juice shelves are kind of empty and stuff like that. I don't like seeing that because juice is pretty much glorified sugar water, even if it's 100% juice. So think about how many pieces of fruit, if it's 100% juice, how many pieces of fruit had to go into that 10 or 12 ounce bottle to make that juice from that fruit. You wouldn't sit down and go eating, 10 or 12 apples, right? So that's probably what it took to make, a couple bottles of juice. So think about, if you're going to drink the juice, I would much prefer that you eat the piece of fruit instead, because at least you're getting some of the fiber and some of the other benefits of that whole food, and you're not just coating your teeth with the sugar from the juice, right? So just kind of mitigating the juice, the energy drinks, the acidic drinks like carbonation, anything carbonated is going to be pretty acidic. So definitely kind of cutting down on that, or maybe drinking it through a straw. The high sugar drinks too, like juice and milk. Anything besides whole milk is probably, any milk besides whole milk is probably not your best bet. It's pretty sugary, to be perfectly honest. It's got its own kind of natural sugars in there. And so I do see a lot of cavities in younger kids that they drink milk after they've brushed their teeth, like before bed. So keeping that in mind too. Milk is also a source of those sugary carbohydrates, even though they're more naturally occurring in that milk. So kind of mitigating your acidic and sugary drink intake. Also kind of reducing and maybe being very conscious of the foods that you're stocking up on. The pastas and the breads and that kind of stuff are not going to do your teeth any favors. So making sure that you're at least rinsing out with water, or reducing those just kind of in general is kind of the better route to go. I don't think, once the supply chain has caught up in the grocery stores and everything, I think that we'll be just fine as far as, the availability of healthy foods and stuff. So keeping in mind that, if you need your neighbor to go pick up some groceries for you, if you are social distancing and needing to stay at home, a lot of neighbors are really coming out of the woodwork to help each other out. So there are definitely some options out there, and let's stay healthy.